that weren't able to make it at this time, but wanted to see the recording. So I wanted to make sure that we had it available for them. We would like to thank our sponsors. Let me share some slides with you. I know it's always easier to read things sometimes than just hear them. So I've decided to make a little slideshow for you guys. That being said, I am not extremely good at design, so they're very simple slides. I would like to thank our sponsors today, Bristol Myers Squibb, Amgen Oncology, and Karyopharm Therapeutics. And again, I just welcome you to the launch of our plasma cell leukemia chapter. Let's talk about why we wanted to launch this support group. There is not a large published body of knowledge of what has worked and hasn't worked when it comes to PCL treatments. Paul, who I will introduce later, he has mentioned that there is a small publishing about auto versus auto-allo transplants. However, there's no large body of knowledge of what works or what doesn't work. However, we believe at the Myeloma Crowd that by joining together and sharing experiences and talking about it, we will not only connect with, learn from, and support one another, but we will also be able to grow in knowledge together and find treatments that work for PCL. There's already been so many advancements in the PCL field because of new drugs that have been discovered or different treatment options. And I feel that when we combine our ideas together and our experiences, that we'll just be able to accelerate better treatment for PCL. To begin our meeting, I would like to show you two videos from Health Tree University that explain the basics of PCL. I'm not sure how many of you are recently diagnosed, and it's always nice to just have a refresher. And then our second video, we'll talk about the differences between primary and secondary plasma cell leukemia. So let's start with this video.
What is plasma cell leukemia? Normally, plasma cells stay inside the bone, and even with myeloma, plasma cells usually stay within the bone marrow. However, in some patients, these cells can escape into the blood.
If you can detect plasma cells in the blood on what we will call more of a macro level. So in other words, if the pathologist and the hematologist look under the microscope and they see circulating plasma cells that are malignant, in high levels of this is called plasma cell leukemia. It's often associated with high-risk cytogenetic features. It's often a little more aggressive and often difficult to control.
What is plasma cell leukemia? Okay, this is a terrible thing that we've named this. I don't know why we named it this way. It causes such confusion. So what type of myeloma do you have? That's one of my key things. Do you have easy to treat, intermediate, or hard to treat? What's the status of your myeloma? Is it controlled, waking up, or uncontrolled? And the last thing I ask in a small proportion of myeloma patients is, where is your myeloma? Is it in the marrow? Does it involve your bones? Is it chewing at your bones, causing holes in your bones and increasing your risk of fracture? Is it in your blood? Is it slippery so that they can slip out of the bone marrow and head into your blood? If these myeloma cells are slippery and head into your blood, that means that they are already relatively chemotherapy resistant. Because they're so slippery, they tend to be able to travel. They are less like my in-laws, and they can go and flourish wherever the heck they want to. This is more aggressive. And in fact, if there's 20% or more of these things, we call it plasma cell leukemia. All that means is that it's hard to treat myeloma, and it happens to have a large number of myeloma cells in the blood.
How do you diagnose plasma cell leukemia?
So on average, you do a blood test at a reasonable medical center, and they're going to do a CBC. Probably all myeloma patients here have had a CBC, a complete blood count, white cells, red cells, platelets. On the white cells, they should do a differential, and they should obviously see the myeloma cells percolating along in your blood. That's how it should happen. Does it always happen that way? No. A lot of times people do differentials and they just look and they say, oh, there's some granulocytes, lymphocytes, and whatever, monocytes, something or other. Sometimes they miss the fact, wait a minute, these are all myeloma cells circulating in the blood. It's disturbing how often that is missed.
All right, so hopefully that was a fun, well, I don't know if the word fun is the right word there, but hopefully that was an interesting way of describing plasma cell leukemia. Let's talk about the difference then between primary and secondary leukemia. Plasma cell leukemia, I should say. All right, let me pull it up here and then we can play.
What is the difference between primary and secondary plasma cell leukemia?
Primary PCL is where the patients present with circulating plasma cells. It's not clear how that arose because we don't know previously because they're presenting with a new diagnosis, but again, it's a very aggressive disease and it needs to be treated aggressively. We do have treatment modalities that allow this to be controlled and controlled for a long period of time. It used to be a real problem and now it's gotten better with better therapies, especially with the new agents. Such things as extramedullary plasmacytomas, plasma cell leukemia, that's secondary. There are a variety of things that are probably a reflection of the fact that disease has become more and more resistant to therapy. Because usually these patients have received prior therapy, and if they've received a lot of prior agents and are running out of treatment options, it often is a signal for a far more aggressive disease that could be very life-threatening.
So that being said, this plasma cell leukemia support group, while our resources are primarily for, hold on, let me turn off YouTube. So while as I was saying, as our resources and treatment options that we share in this group are mainly focused on primary PCL patient and caregiver advice, we do welcome secondary PCL patients and caregivers. We want them to share their experience and treatment options here as well. So we are a support group for both types of PCL. This is normally the time when I would introduce to you our featured speaker, but he has actually requested to hear from you first. So I'm going to put a slide up with what we would like to know about you. If you don't feel comfortable sharing in this group setting, that's fine. A way of indicating that to me would be turning off your camera. If you do want to share your story in the support group, we would love that. And please keep your cameras on. I will go down the list of participants, and those whose cameras are on, I will call on one at a time to share. Let me share that slide so that we know, as I was saying, the questions. Otherwise, sometimes it can be hard to remember. And let's get started. So Lori, if you feel comfortable, Lori Mitchell, would you mind sharing your PCL story with us? Just what's on the slide and anything else you'd like to share?
Sure. Can you hear me?
Yes. Yeah, we can hear you.
Okay. Hi, everybody. I am really happy to be here today. I appreciate you doing this for us. I appreciate it so much. Where do I live? I live in Birmingham, Alabama. I am the patient. I'm at UAB, University of Birmingham. It's the one of the best cancer hospitals. Well, it's the best in Alabama, and it is known throughout the country, actually. I am seeing a specialist there. I actually started out at a local hospital, Grandview, and because I was being treated for multiple myeloma. Well, then I wound up in the hospital, literally on life support.
Wow.
My whole body was shutting down. And because of that, I hadn't been able to start treatment. Well, because my treatment was delayed, it turned into plasma cell leukemia. While I was in the hospital, they said it had then gone into my blood. So my doctor at that local hospital, he said, you have got to see a specialist.
Yeah.
I can't treat this. So I went to UAB, and I am now with a specialist that has done research for multiple myeloma and plasma cell leukemia. And I was diagnosed in June. It will be 2 years. It was June 30, 2019. I had a stem cell transplant. Tomorrow is my first rebirth day.
Oh, congratulations.
Oh, thanks. So, 9th of last year, I was able to have stem cell. I am now in complete response. I'm on Revlimid still, which I don't know if I'll be on the rest of my life.
Right.
I still had bone issues. When I was diagnosed, I had a broken pelvis, sternum, both sides of the ribs, and left arm. So it has really affected my bones. But I am in complete response now, although I still have a lot of pain, and my doctor said I'll be living a long time because of the damage. But I wanted to join this group because I love meeting people that understand, and I want to hear what you've been through and what are you doing. Right now I'm doing great, except for the pain and all that. But what if it comes back? What are my options? What have you, and I just like to support people and to have people that can support me, So I'm great, and thank you so much again for doing this. I probably talked too much.
No. That's perfect. That's exactly what we want. Thank you so much for sharing. I forgot to mention before Lori started, if you aren't talking, if you mind turning off your microphone so that we don't get background noise. If you're not sure how to turn off your microphone, I know Google Meet is a new platform for a lot of people. Move your cursor to the bottom of the screen or your finger if you're using a phone, and a white bar should pop up where you see a microphone icon. If you just click that microphone icon, you'll be able to turn your audio off. All right, let's go with MJ Petruska. Did I say that wrong? I probably said it wrong.
Petroska.
Petruska.
That's fine. You were close. I live just outside of Charlotte, North Carolina, and I am the patient. My wife here is my caregiver. She's here with me, and I was diagnosed. I'm being treated at Levine Cancer Institute in Charlotte, which I feel, I know Lori said that she was at the best place, and I feel that I'm at the best place. It was a blessing to end up there. I was diagnosed in June of 2020. I'm a family physician, and I was feeling a little bit sluggish, and I was bruising very easily. And I talked to my partner, and the day after Father's Day, I came in and had fasting blood work done at my clinic, and I went on to see. I had 27 patients scheduled that day, and I was seeing my patients. And around 2:00 in the afternoon, my lab work came back, and he grabbed me in between patients going in and out of exam rooms, and he took me over to his office and showed me my labs on his computer. And my hemoglobin was 4, and my platelets were 32. And so I did what any logical thinking person would do. I just got in my car and I drove to the hospital. I called my wife on the way and said, I'm going to the hospital. There's something up. My blood count's low. So they did they confirmed it there, and I was transfused a couple units, and I got platelets. And 2 days later, I had a bone marrow biopsy, and it confirmed the plasma cell leukemia. And then I was transferred. I was at our local hospital in Gastonia, North Carolina, where that I work for, and then I was transferred over to Charlotte to Levine Cancer Center at Atrium Health, and they immediately put me on chemotherapy. I was on Cardapace, and my head was spinning. I'd never been in the hospital before in my life. I never had stitches before until they put the PICC line in my right arm. They did a PET scan that was negative, thankfully, and they did an echocardiogram before starting the chemo, and I was put on that. I did develop some mouth sores from that, and I had to go in the hospital. I had a neutropenic fever after being in the hospital for about a week or 10 days. I came home and I had to go back a week later with a neutropenic fever. So I was in another 5 days. And then at the end of July, I had another round of Cardapace, but my specialist, he decreased the dose on 2 of the medications, and so I didn't have the mouth sores. But whenever I came home, about 4 or 5 days later, I was dehydrated and had to go in overnight. And in November, the day after Thanksgiving, I had a autologous stem cell transplant. So I'm about 60 days out from that, and my hair is just starting to come back in right around here. And I had a bone marrow biopsy this past Monday, and I had all the myeloma markers and cancer markers then. And I go back on February 9th to get the results. I'm feeling pretty good. I walk several times a week. My appetite has returned. I initially lost 25, 30 pounds from the transplant, and I've gained some of that back, and I feel stronger every day. I still get a little bit tired, but not as tired as I was right after the transplant. The main reason I wanted to join this support group was you can't find anything really about plasma cell leukemia. Everything you read is all the dismal stuff from about 4 or 5 years ago that said, whenever I was first diagnosed, the oncologist at the local hospital I was admitted to told me, yeah, you have plasma cell leukemia. You have a prognosis of 7 to 12 months. And I'm there. Well, crap. I'm only 58 years old. I've never been sick. I'm busy. What am I going to do? So after I had treatment, it was a godsend to go to Levine Cancer Center, because my oncologist, who's a multiple myeloma specialist, he is outstanding, and we don't talk about a prognosis like that. We talk about hope, and I've responded really well to the chemo and to the stem cell transplant. All my normal labs, my hemoglobin, hematocrit, white blood cell count, platelets, electrolytes, they're all normal, and they've recovered nicely. So I have hope that I'm looking at this as a chronic disease that can be treated, much like I treat diabetes, hypertension, and COPD and high cholesterol. I'm looking at it like that, and there's so many new treatments out. I'm willing to try any of those, but I won't have a transplant again.
Well, thank you. Yeah. Thank you so much for sharing your story. I really appreciate that. And I don't know, we've only shared 2, and I'm already excited about the support group. So let's keep going. Again, if you do not want to share your story, please keep your camera off. If you do want to share your story, turn your camera on. That's how I'll know who to call on. Let's see. Mary, would you like to go next?
Sure. I am in Ventura County, California, Southern California. So across the country from the folks that have spoken so far, I am the patient. I'm being treated at City of Hope, which is about 50 miles from my home. And I see Dr. Amrita Krishnan there. She's a myeloma specialist and has some experience with PCL. I was diagnosed initially in May of 2017. And I was pretty far advanced when I was diagnosed. I had multiple rib fractures in my hips. Within a week of my diagnosis and getting it confirmed with a bone marrow biopsy, I started my first round of DVT PACE. I did 2 rounds of that. After each round, about 10 days later, I also was hospitalized with a neutropenic fever. But the 2 rounds of DVT PACE entirely suppressed the myeloma. When I was diagnosed, I had almost 100% replacement of myeloma cells in my bone marrow biopsy. And my PET scan lit up. I lit up like a Christmas tree on the PET scan. And after the second round of DVT PACE, there was nothing on the PET scan. There was nothing in a bone marrow biopsy. There was nothing in my blood. I went through an autologous stem cell transplant in October of 2017. And since that time, I've been in stringent complete remission. I had an MRD negative test a year after the bone marrow biopsy. Since then, it's been MRD positive, but my most recent MRD test, which I had in November of this year, I had 1 myeloma cell per million. So that is virtually nothing in my blood. I'm on a pretty significant treatment regimen, but I tolerate it really well. I have daratumumab. Now I'd have that once a month. Initially, it's weekly, then it goes down to every other week. I've been on it since January of 2018. I take Revlimid 2 weeks on, 2 weeks off. I get a Velcade shot once a week, and I'm on everybody's favorite drug in the world, dexamethasone, once a week on my treatment day. So I have 1 day a week where I get very little sleep and do either a lot of housework or sit at my computer and write or watch a movie or read a book, since I get about 2 hours of sleep. But overall, as I said, I'm tolerating the treatment regimen really well. And as sick as I was initially, and I was really sick initially, I pretty much have my life back now. I'm fatigued some on the days that I take Revlimid, but I take it at night. But pandemic notwithstanding, I travel. I've gotten to see one of my daughters graduate high school. My next goal is to see my next daughter graduate high school in 2 years. And my older daughter, who graduated last year, is at the University of Alabama. So Lisa, I think your name was Lisa, who is in Birmingham. My daughter is about 45 minutes from you, down the road in Tuscaloosa. So I am grateful every single day. And I also am hoping to view this as a chronic condition and not as, initially, of course, when I was diagnosed, I went on the internet, read everything I shouldn't have read about PCL, regretted it, but as my doctors continuously remind me, you're not a statistic, you're an individual. And I've responded very, very well to the treatment so far. And this is my first line of treatment, and I'm now 3.5 years down the road from my diagnosis, a little more than 3 years from my stem cell transplant, and still very stable, and the disease is entirely controlled. I know that won't be forever, because it isn't with this condition, but I also know there's a lot of new medications out there. There's a lot of things to be hopeful about, and that's where I kind of focus. Why I wanted to join this group was because I've only ever met in real life one other person with PCL. I take part in 2 myeloma support groups in my local area, but they're all both remote now. But I've only ever met one other person with PCL. It's not a common condition, as all of us know. And so to be able to talk to other people who have the thing that I have, not just myeloma, but PCL, is something I'm looking forward to.
Good, great. We're so glad you're here. And what a story of hope. That's incredible. Okay, we have 2 other Marys. This is exciting. So Mary Finlayson, I probably butchered your name as well, but go ahead and share your story with us.
Thank you. You did pretty good. I live in North Florida, and I'm the patient. My husband's here with me, and he probably will have to help me if I try to tell you which treatments I've gone through, because it's been quite a few. I see a local oncologist in Tallahassee, and then I have a primary at Moffitt, specialist at Moffitt in Tampa. I was diagnosed in November of 2018, and they were trying to get me in for the transplant, but it took quite a while and changing treatments and trying quite a bit to get my numbers down. And so I had that done September of 2019. And since then, my numbers have gone back up. I think it was February, it was at 60% when they did the bone marrow biopsy. So it was definitely going back up. And and they switched me to Kyprolis and Cytoxin with dexamethasone, and I've responded really well to that, to the point that they've actually dropped the Cytoxin, and I'm just doing the Kyprolis and dexamethasone now. So it's been a journey getting here. I actually started pain in 2011, and had gone over to Mayo Clinic, and they'd done all kinds of testing on me and said I had fibromyalgia, and I did not agree with that. But I have kappa light chain. It was hard to diagnose. And until I was just in terrible, terrible pain, I went back to my internist and said, we've got to do something. And at that time, my blood work was just a mess, and didn't show up anything in x-rays. But when they did the CT scan, there were several spots on my spine and back that they did see, but not in the x-ray. So a process getting here, but doing really good now. I've changed my diet, trying to do everything I can to make my body inhospitable to cancer, taking supplements, and so far so good with this.
Great. Thank you so much for sharing. And, I like sharing our stories because we see the differences. Sometimes the SET works, sometimes it doesn't. Sometimes we have to change treatments. And so I appreciate you, Mary, sharing that story. Thank you.
Thank you.
Mary Lou Mackus, do you want to share your story with us?
Turn on my microphone. How's that?
Perfect.
I divide my time between Wisconsin and Florida. I'm in Florida in the winter. So it was March of 2017 I was diagnosed. It was kind of I word search now with all this treatment. I'm sure everybody understands that part. It was kind of providential that they found the disease at all. I'd been feeling tired, but nothing that I thought, ever stopped and thought, I'm feeling tired. You just keep going. I also have migraines, so there are many days when I didn't feel well with my migraine. So I've just always learned to work through it. So my primary care doctor did a CBC on me I was seeing her for the last time because she was not going to be a primary any longer. So anyway, long story short, my hemoglobin was 6, and I don't remember what my the rest of the blood work was, but she says, how are you functioning? I said, I don't know. I just do, I'm a woman. You don't stop. So anyway, diagnosed in, so locally I'm in St. Petersburg, Florida, and saw a local oncologist, hematologist, and he wanted to start treatment on me. And I said, time out, I want a second opinion. Also, I'm a nurse, so I knew to have a second opinion. So I went to Moffitt, as Mary did, go to Moffitt. And Moffitt recommended a stem cell transplant. So I did have a stem cell transplant in July of 2017. And I was in MRD 0. I was in complete remission. I did the Revlimid for a little while, but I didn't like the side effects. So I stopped the Revlimid, and I was in with no treatment whatsoever for a year. And I was in remission for 11 months. So I was diagnosed in 2017. I had my first remission in August of 2018, and my second relapse in August of 2019. When I relapsed in 2019, I started daratumumab, and I was taking it monthly, and then I was on Pomalyst. It reactivated my hand and foot neuropathy. I only did one round of that, and then I went to just Darzalex, easy for me to say than the other one. I went to Darzalex once a month. So I was controlled, my numbers. I didn't go back in remission, but I was under 200 for my light chains, and feeling good with that. The plasma cell leukemia, when I was diagnosed, my plasma cells were 24.5%. My oncologist in St. Petersburg felt that I had just, he didn't feel that I had a true primary cell plasma cell leukemia. He felt that I had just, because the way my numbers were, he said, this isn't, plasma cell leukemia comes on suddenly and you're very, very ill. And that was his take on it. And he said, because I had, for so long functioned, he says, your body adapted to it. And he said, and the plasma cells then leaked into just a time thing. So it was a moot point whether it was plasma cell leukemia or not truly, because once you get anybody say that you have plasma cell leukemia, you have plasma cell leukemia. So I don't know if anyone else has experienced that, but it frustrated me a little bit because I rather like what my oncologist said about, the cells leaking, because there were studies that plasma cell leukemia, they don't allow you in the study if you have plasma cell leukemia. And I always felt that that was not right, that they should do that, but how they are with their studies and controlling everything. So anyway, till September, I had my last Darzalex in September of this year. And then my numbers were still going up, not dramatically, but still going up. And my doctor called me and he said he could get me into a CAR T study. And this is when I'm in Wisconsin, I work with the Medical College of Wisconsin at their myeloma center. And they have Dr. Hari. I don't have Dr. Hari. He's well known in the literature, but I have his associate, Dr. Shabra, who's my oncologist. So he got me in a study, a Cartesian. Cartesian is the manufacturer of the CAR T cells. So I had to go through a lot of testing before I was, eligible for the treatment, the CAR T. And when I was first diagnosed, I had a bone scan and it showed no lytic lesions. So we weren't, especially worried about my bones. And I had Zometa on and off, but I had to stop it because I was having oral surgery done. And, the oral surgeons don't want you on the Zometa. So I've been off the Zometa for over a year. And I had to come back here to Florida to complete the second phase of my tooth implant that I'm having after trying to save a tooth for a year. So I don't know about you guys, but it's the disease, besides being life-threatening and everything it is, it's just wreaked havoc on myself from head to toe. I lost a lot of weight, haven't been able to really gain the weight back, but I eat, I do fine. Anyway, I know I'm rambling, but the next part of the story isn't so cheerful. So I had to have a PET scan for the CAR T, and the PET scan showed multiple areas of bone involvement. So now I have bone involvement. So my doctor said, you have to be very careful. So I was being very careful, and he wanted me to see an ortho, and he said, we might need to rod you prophylactically. Well, the first thing I said to that is, I don't want that, that sounds awful. I don't want to have that done. So I said, I'm being very careful. So I actually didn't have any pain until November. And I had been in Arizona in October for 2 weeks. And I had golfed 3 times when I was there. So I am a very active person, And I noticed when I was walking that it was getting harder to walk long distances. I would have pain after long distances in my right leg. Well, that pain just kept going. I had an appointment with my oncologist November 11th to go over all the results of the testing. And I had to call and get into my primary to get something for pain for my leg. So that's when it all activated, okay? So the oncologist wanted me to go back to the bone doctor. And I said, why don't you just send him my scans? Why do I have to physically go there? If anything, I'm not the easiest patient around. I try very much to control what's an uncontrollable situation. And being a nurse, and I know that Dr. Petruska can also appreciate this, you know too much too. I mean, you understand it all. And I've always told the doctors, I understand all of this. And my goal has always been quality of life, not just life. Okay. So that's why I've been very directive with my care, working in partnership with my doctors. And that's the way I said, you're on my team. And I have a team in Wisconsin and I have a team in Florida. And so I work with my team. That my team is not always happy with me. I mean, my oncologist told me that I think I'm always right. Well, I don't think I'm always right, but I try to do what's always right for me. Okay. And, you can't say because this disease has so many variables and, there's so much going on and, they can't say, this is the treatment, follow this and you'll be cured, So because everything is very variable, it's truly personalized medicine, really, as much as they can. And I was very excited to be able to get into the CAR T, obviously, because I always thought I'd never be able to get into it because of the plasma cell leukemia hanging over my head. So I started it was the CAR T cells. The studies have been done where they've given one infusion, one and done. And so this study was designed that if they gave multiple infusions of your cells, if you would get a better long-term outcome. So I was due to start I had to have 3 days of chemotherapy, conditioning chemotherapy, and it was fludarabine and Cytoxan, I think. So it was November 17th, 18th, and 19th. On the 19th, I was going in for my third and last round of chemo. And the next week I was starting the infusions of the CAR T. When I was getting ready to go to the doctor, I was sitting on the edge of the tub, putting on my, the women will know, Uggs boots, So I had to kind of tug to pull the boot on. And as I tugged, my leg broke. I felt it. And so then I lost my balance and I fell onto my left arm and I broke my left arm. So my right leg broke above the kneecap. And as I fell on the floor, I saw that it was broken and I heard it crack. It's the kind of thing you don't want to. It was the worst experience of my life ever, ever, ever. And I can't say worse than childbirth because I had 2 C-sections, so I can't tell you that. But I've had pain in my life, and this was the worst pain ever. And I think whoever has all that bone pain, I really can identify with that. So I had to have surgery on the 20th, and now what about the study, So they called the national study coordinator, and he waived the 3rd round of chemo, which was really nice. And I had surgery on Friday the 20th, and I was out that next Monday of the hospital, and I had the first CAR T on Tuesday. Okay, so they allowed me to stay in the study. All right, so fresh from surgery and rotting and all that stuff, I went in the CAR T. I had 4 rounds of CAR T times 2. So they did 4 rounds, 2 a week. Then I had a week off. Then I did 4 more rounds in 2 weeks. So I finished my last CAR T on the 31st of December. And in the meantime, the ortho who did my rotting said if I had any pain anywhere else, I should let him know because I was at very high risk. So I noticed that when I pulled the covers in bed, my left, to turn over, my left arm hurt, and you would expect that I had the rod in it, but the right arm seemed to hurt as equally, and I didn't have anything going on in the right arm that I knew of. So I mentioned it he said the ortho has a subspecialty in pathological fractures. So that's a nice thing about working with medical, like at the medical college with practices that have these subspecialists. So why they didn't send my films to the subspecialist, I don't know. It turns out the ortho they sent my films to review to said I wasn't at risk for fracture. How do you like that? And the my doctor said, well, it's too late. She's already fractured and she's rotted and, had surgery. So I guess it's very, the degree of figuring out how much you're at risk with your bone is not a perfect art, obviously. It's an art, not a science. So, all right, now it's January. Well, my right arm hurt. I went in for the x-ray. I had disease in my right arm. He recommended that I rod my right arm. Well, I'm still recovering from the other one. This is not something I wanted to hear, obviously, or I wanted to do, but I was very frightened because I had gone through the worst pain of my life. So I said, well, can you guarantee that I can be to Florida by January 20th? Because I had to be down here to see the oral surgeon to finish stage 2 of my tooth. And he said, yes. And he said, and I'll do it as an outpatient. So on December 23rd, I had the right arm rodded. So I have 2 rods in my arms and a rod and a plate and screws in my leg. And back to, they worked around the second surgery and allowed me to have my CAR-T. So I finished, the bottom line is I finished the study. They like to see that you're, what they're looking to see after you get the CAR-T is that your light chains go down. And my light chains did not go down. So my doctor in Milwaukee is feeling like it's not working. The CAR-T is not working. And my doctor here, who I just saw on Tuesday, who's always he sees, the glass is half full instead of half empty. So he's a little more cheerful all the time. He feels that the CAR-T is a long-term, it could take a while for them to, my own cells to take in my body and affect so I'm liking his idea, that maybe it's just going to take a little while longer. I just had my blood work done on Tuesday. I was just checking it as we were talking, and my light chains haven't changed. So if the CAR-T is going to work, it's anytime now. I don't know. It's not working. So in the meantime, we're trying, my team from Milwaukee and Florida and Dr. Mason St. Petersburg are conferring. But that's easier said than done. It's like herding cats. I went in to see the doctor on Tuesday. Before I left Milwaukee, I told them when I was going to see Dr. Mace. I asked to have all my stuff there and would they confer, and oh yeah. I got there on Tuesday, he had nothing. Well, I'm prepared for that they never do what they say they're gonna do. So I had all my records pretty much, a lot of relevant. And because I'm a nurse, I can tell you what happened, exactly when it happened. So he said, it's not a problem that I don't have the records because you can always tell me what happened. And I had blood work to give him. So then my charted message to Milwaukee and I said, what the heck, what happened to my stuff? And they apologized profusely, thought the appointment was next week, blah, blah, blah. And bottom line, they said Dr. Shabra did call Dr. Mace on Tuesday. So, and the third thing I have to do is make an appointment with Moffitt, and I tried to make a teleconference appointment on the website, and that was 2 days ago, and I haven't heard anything from them. So I don't know really what to do about them. But anyway, I know that's a lot of information. I'm rambling. I wish I could say that I had the CAR-T and I'm cured because that's what I was hoping for. Of course, we all were, but that's not where I am. But I am holding out hope that the CAR-T is going to make a difference. And my doctor said as long as my light chains are under 200, we don't have to treat. And my light chain was 183. So I'm sort of in a lull here between treatment, which is okay because I have a lot of recovering to do from bones issues. I started physical therapy yesterday and my evaluation for that.
Okay, Mary,
So,
I'm gonna cut you off just because we have more people. But
sorry.
no, it's okay. Thank you for sharing your story, and I think it's a great example of why we need to be our own best advocate in the medical field. So you're in a unique position as a nurse, and I think it applies to everyone here that you are going to have different medical teams, and you do need to learn how to be your own best advocate, even if they say that you think you know everything. Well, you do know what's best for you, Mary. So keep on doing what you think is best for you, and go with that gut. Let's have Richard share his story. Richard, will you share your story with us?
Yeah, hi everybody. And thanks for putting this on, giving us an opportunity to share our story and get together. I live in San Clemente, California. I'm a patient. My caregiver is my wife, who's also sitting here beside me and may try to correct me from time to time. I was initially diagnosed the end of 2019. I'd seen my GP and got some routine blood work done, and I'd been complaining about having some back pain because of a fall 6 months prior, and a large hematoma developed on my back and didn't seem to be going away. So just coincidentally, and luckily, he connected my complaint about having back pain with the possibility that I might be suffering from multiple myeloma. So he did some more tests, and then referred me over to an oncologist, hematologist, who, with several other tests, verified that in fact I did have multiple myeloma as well as PCL, with the numbers being quite high. And he put me on a regimen initially of Cytoxan, Velcade, and Dex, and was of the opinion, because I'm 76 years old, 75 at the time, that I probably wasn't somebody who would be a candidate for an autologous transplant. My daughter, who's quite stubborn, insisted that I see a myeloma specialist and not accept the oncologist's opinion. So I went out to City of Hope and met with a doctor there who evaluated me and decided, because of my physical condition, unlike my oncologist, she thought that I was a good candidate for a transplant. And she recommended that the chemo be switched from the Cytoxan to RVD. And I took that again for another 2.5 months or so. And it got me into a good remission, nearly a complete remission. And then I was referred by my insurance carrier to Norris Cancer Hospital in Los Angeles. And I saw a specialist by the name of Ann Moorbacher, who I can't say enough about. She's really super. And like the City of Hope doctor, she thought I was a good candidate for the autologous transplant. So I prepped for that and went in the end of August and was given the conditioning regimen of the melphalan, and then received the autologous transplant. Spent about 12 or 13 days in the hospital recovering, and I weighed 226 pounds, and I came out of the hospital at 189. Did not eat a thing while I was in the hospital after the first day, and after having told my wife how good the food was in the hospital. But by the second day, I wanted absolutely nothing. And since then, since September, I've been recovering, really knocked out for the first month or two. Didn't feel like exercising. My appetite gradually came back. I gained back 10 pounds or so. And I've gotten to the point now where I'm able to exercise pretty regularly. My appetite is back. I'm still surprising my myeloma specialist, very happy with the results. Still in remission, and I'm getting ready to start on a daily 10 milligram Revlimid regimen on Saturday. So the only other thing that I would add is I found out, because I'm a veteran, Vietnam veteran, that the cause of my PCL myeloma was likely Agent Orange in Vietnam. And the good side of that is the VA put me on disability, so and they're providing any treatment that I'm not able to receive, they'll provide as well.
That's great. I want to say great news. For what it is, it's good news that you can get that support. And thank you also for your service for our country.
You bet.
Great. Thank you, Richard, for sharing your story.
Sure.
There's one more. I don't know your name because it doesn't show up, but you have cute glasses and brownish hair. If you want to share your story and tell us your name too. No, I can't hear you. There we go.
I'm Catherine Ratliff. I was a few minutes late being here because I really thought this was supposed to start at 11.
I know. I'm sorry about
I
that.
thought Denver was someone's name, and I didn't realize it was Mountain Central Time.
My bad.
I'm here. Let's see. So I'm Catherine, and I'm actually a caregiver for my husband. And how I found out about this was I was on a support group actually on Facebook, and I just didn't like what I was hearing. I didn't like the way they were extremely negative. It wasn't uplifting. So I met a guy there that was really good, and I met a lady there also. And actually, one of the men that's there now is Paul. And so I went to him privately on Messenger, and I said, because he was also talking to me, I felt like he was a Christian, and I believe in prayer. And so I went to him and I said, I need help. And this is just all new to me. And he has been very kind, and he actually invited me to this group. So I actually feel pretty bad for a lot of you, all of you actually. It's a terrible thing to go through, and you all will be in my prayers tonight. But my husband and I, we were only married 1 year. And right before our 1 year anniversary, I noticed in church he was having trouble standing, and I found out later that he was having pains with his legs. And so what I told him was, you need to see a doctor. I didn't want to scare him, but I said it may be blood clots. Sure enough, it was blood clots. So they put him on blood thinner. They also had to put a mesh, I think, in his left lung. He had a major blood clot in his left lung, and he had a clot in his left leg. So they put a mesh in his left lung right now. So September rolls around, and he's just not looking good. His eyes were starting to set back into his head. He was losing weight, and I thought, something's not right. And then I think it was late September, early October, 2019 to give the year. I wanted to visit my mother in Florida, and we're from Tennessee. And I was supposed to visit her on a Wednesday, and I told him on Monday we're going to see a doctor because I noticed he was having shortness of breath. Well, he said, no, you need to go to Florida. And I said, no. I said, you really need to see a doctor. He thought it was from about a month of not exercising, but and I said, no, that wouldn't cause, I'm a teacher, but you can't do that. So Tuesday, that night, I remember I was just praying, like, come on, intervene somehow, God. Tuesday comes around. He just doesn't look right. And I told him to take a shower. And he did. And while he was taking a shower, I just put my hair in a ponytail, put my sweatpants on, everything. And he comes out of the shower and he can't breathe. And I said, you have two choices. You either come with me to the doctor or I'm going to call 911. So we go to the hospital, emergency. They found out that he had 4 liters of blood in his right lung. They drained 4 liters of blood. Okay, once they drained the blood, they also he had a minor surgery to clean up the lung area in the right lung. And then this doctor walks in 3 days later after they had given my husband a strong dose of antibiotics. So this doctor walks in with a white lab coat, and it says oncologist. And I said, excuse me, sir. I said, I think you have the wrong room. And he said, is this Mr. Ratliff? And my heart just dropped. That was just, and they said that he had, it's aggressive. stage 3 multiple myeloma, plasma cell leukemia. And they kept saying, what are you going to do? What are you going to do? And we were just beyond ourselves. We were just married a year. So we found someone in Nashville that specializes with plasma cell leukemia. But that's 4 hours away from us. We're near Pigeon Forge, Gatlinburg area. So we went there initially, and we were just going once a week to get treatments and all. And I don't have my other book with me, but I have everything written down what he had. And he started it toward the end of October. Then, I think it was in December, we decided to go to the doctor in Knoxville. And we noticed we didn't feel like he was getting the exact same treatment or how they were doing it in Nashville, but I think that's where we made our mistake, I think, I just don't know right now, but all I know is January of last year, they only gave him 2 days to live. And I told the doctor, while we were in Nashville, I told him, no, I said, there's power in prayer. And by the 3rd day, they had him prepped for dying. And I had thousands of people praying for him. They had him on between 4 and 5 different types of strong dose chemo, 24 hours, 4 days in a row. And on the 5th day, I said, you need to feed him. And they said he couldn't swallow. He wasn't talking to me. I forgot videos and everything, just to keep things to see what's going on. And she said he couldn't eat. And I said, let's think about this. Just please put a feeding tube in. I feel strong in my heart. You need to put a feeding tube in. So they did that. On the 6th day, I started playing. And it sounds kind of crazy, but he likes Christian music. And I was playing the music in his ear. And all of a sudden, his head just started listening to it. And I remember telling him I love him. And because he would respond, I love you too. But he wasn't talking. That was the first time he said, I love you too. And he looked at me and he said, very much. And I just kept communicating with him. On the 6th day, he started walking. They put him in Sarah Cannon Cancer Center, and that is in Nashville, named after Minnie Pearl. Maybe some of you know her, Minnie Pearl. And they only take in leukemia patients and other cancer patients. April of 2020, he had his first stem cell transplant. That's when we met Dr. Jesus Verdeja. It's kind of a cute name, Jesus, Jesus Verdeja is a graduate from Harvard. He specializes in stem cell transplants. He is one of the best known, and he's been world round. He had his first stem cell transplant. He did excellent. He had a second one in August. He didn't do too well on that one. It was a little hard. It was much harder for him, much harder. And thankful for my friend Paul. I just cry out to him all the time. This is so new to me. I don't understand what's going on. Even though I know I could ask, and they do tell us things, it's just that it's just still unreal. And as a caregiver, it's been really hard on me too, because I don't understand a lot of this stuff. I'm now, that's why I like the support group. I think I'm going to learn more. Right now, he was taking Darzalex for 8 weeks straight. And now he's going to take 8 more of those shots every other week. And after that, it'll be once a month. He was put on Pomalyst. He was on 4 milligrams, and they knocked it down to 2. Because apparently it's knocking his white blood count down and his ANC down. And so now for 2 weeks, he's been off of the Pomalyst. And I said, well, why don't you take him off the Darzalex? I really think he needs this Pomalyst. But they said that they think that the Pomalyst is putting everything low. So we're still hanging in there. He's not in here because he's just really tired today. So anyway, that's why.
Wow. Thank you so much, Catherine. Thank you for sharing your story. That's, hopeful that, again, you guys were your own best advocates. You said, no, I really think this is what's going to work. And then look at him now. So way to be. I appreciate each of you participating. I know we're running a little bit over, but I do want you to hear a little bit from Paul. And then Paul, if you share a little bit of your story and then kind of explain the survey, we won't necessarily go through it with them just because of lack of time, but we are sending you a follow-up survey and this recording. So Paul's going to explain that a little bit just before we let you go. If you need to leave, feel free to, because again, you're going to receive a recording. So yeah, go ahead, Paul.
Hi, good afternoon. My name is Paul Klutken. You may have seen my name in some Myeloma Crowd posts that Jenny puts up every once in a while. And some of you also may know my wife, Vicky, who is pretty active, I think, on the PCL Facebook group. I was originally diagnosed in January 2014. And I was diagnosed and I am being treated at Duke. No offense to you, Jay. You think Levine is best, we think the Blue Devils are better. At time of diagnosis, my bone marrow was 100% packed with plasma cells, cancerous plasma cells, at 40% circulating plasma cells and blood. And I've heard the term light chains mentioned a couple of times already, so you're all familiar with light chain ratios. And typically, your light chain ratios, if they're between 1 and 3, they're pretty much perfect. My first test, when I got my first result back, my light chain ratio was 123,000. At the original consult at Duke, I was given less than 30 days unless I started treatment right then and there. And I received my first 2 doses of chemo 2 hours after diagnosis. And that was late in the day. They actually ended up keeping one of the staff nurses there after hours to administer those. And the following morning, I received my first 2 units of plasma. Originally, I was scheduled for the treatment plan was a number of cycles of RVD, Revlimid, Velcade, Dex. And the name of the game was to get me into transplant as fast as possible. I was able to get my numbers down fast enough so that after my first 4 cycles, I was scheduled for transplant. As I said, originally I was scheduled for an auto and an allo back-to-back, and Duke had actually already identified literally a perfect match for me. And at the very last minute, on the advice of my oncologist, before my allo, and after the first auto, she mentioned to me she'd just come back from one of the international conferences, and she said, "Look, Paul, there's some interesting data that came out of a study in Italy that for plasma cell leukemia, auto actually works better than auto-allo." And, we ended up talking about the differences, and we ended up talking about especially the differences in the risk of an allo. And she goes, I understand that you're really big in quality of life. If you want to have quality of life, you're bound to not get it with an allo transplant as your second transplant. So we ended up going from auto. And just as Catherine mentioned a few minutes ago, my second transplant was a heck of a lot more difficult than my first transplant. But when they did the first bone marrow biopsy, after my consolidation, my 2-cycle consolidation, I actually showed up as under stringent complete response MRD negative. And I am still on my first line of treatment now, 7 years later, Revlimid, Velcade, no Dex, and I'm still stringent complete response MRD negative. So, we're obviously very happy with that. I've been extremely fortunate, not only for being treated at Duke by a true specialist who was familiar with PCL, but listening to all the bone involvement stories from you, I've been extremely fortunate that I have no bone involvement whatsoever. And over the last some years, I exercise probably about 2-3 hours, at least 5 days a week. And I'm generally doing very well. Every once in a while, you get a hiccup, and you work yourself through the hiccup, and you carry on. Which brings us to what we'd like to accomplish in this group here. Obviously, both my wife and I have a keen interest in plasma cell leukemia. As a matter of fact, we have, over the years, we've started to fund a clinical study at Duke that is geared towards PCL, but they're having troubles right now rounding up patients because so many patients are being diverted into CAR T trials. And that's becoming an issue in itself. Myeloma, there are so many myeloma drugs being tried for higher risk myeloma that there aren't enough patients anymore, it seems. Everybody wants to be part of a clinical study. And, some studies seem to be more attractive than, this very interesting program that Duke has, but let's set that aside here. Jenny and I have known each other for the last 4 or 5 years, and occasionally I write posts for Myeloma Crowd. She asked me a couple of years ago to be at a patient advisory board for Myeloma Crowd, and I've done that. And in the last medical advisory board group, we ended up talking about PCL, and coming out of that, her recommendation was that we start a PCL support group. And the main intent of this group is obviously listen to each other, learn from each other, and talk to each other. But there is another intent. And, Jay made an interesting comment early in the afternoon when he said that there is very little in the medical journals being published out in PCL. It doesn't seem like anybody is interested in it. And, you can understand that there's about 130 new patients diagnosed in the US with PCL per year. And there isn't a single sane pharmaceutical company in the world that wants to invest in drugs that treats 130 people per year. So we always end up being kind of the forgotten wheel on the wagon here. The only thing we've learned in PCL over the last few years is that's been backed up with some level of evidence is that stem cell transplants still seem to be the best route to go, especially the auto route. And unlike high-risk myeloma, where many patients end up choosing for auto allo, that is not necessarily recommended anymore for PCL. But, what set us thinking in the last medical advisory group is, a number of people have signed up for Health3, posted their records there. And what we're trying to find out now is what the correlations are between positive outcomes or less than positive outcomes against certain treatment regimens, certain patient characteristics, and so on and so on. And to that purpose, we have a fairly short draft questionnaire that will be expanded in the next few weeks, with the input that we're getting from you guys. And Audrey, if you'd be so kind to put up the questionnaire for a second here. So, we have this survey, and it talks a little bit why we're doing it, and I just explained that. We're asking for an email address, the age of diagnosis, and then we'll talk a little bit about, describe your PCL, what type of immunoglobulin you have. I'm, for example, an immunoglobulin D, which is a rare which is a rare immunoglobulin in both PCL and in multiple myeloma. What kind of light chain do you have? For example, my dominant light chain is a lambda, which is also more rare than typically with patients show up with our kappa light chains. What was your light chain ratio when you started? Did you have an M spike? What level M spike? What kind of beta-2 microglobulin level did you have? So we're just trying to understand in rough terms, some key characteristics or attributes of your PCL. Then basically the gender question. Did you have bone involvement at the time of diagnosis? And then, we're going into what kind of induction regimen that you have. Velcade, Revlimid, Dex, Velcade, Thalidomide, Dex, Velcade, Revlimid, Dex, or Velcade, Thalidomide, Dex with Darzalex. Velcade, Revlimid, Dex, or Velcade, Thalidomide, Dex with the PACE combo, and usually that's called, VRD PACE or VDT PACE. And then there are two other. One of them is called Big New Beam. And then there is another one another one of the EAM variants, with the first compound being bendamustine, whereas in Big New Beam, the first compound is carmustine. So we're trying to now also understand if there's been an impact on the outcomes of your myeloma, depending upon your initial treatment regimen. How many cycles of induction? How many cycles of induction therapy did you have? What kind of treatment did you have to marshal your stem cells? Was it just Cytoxan, or was it Cytoxan plus something else? When we're talking about killing the myeloma in your bone marrow, your myeloablation, was it just melphalan or was it something else? And then we're getting into the stem cell transplant, and we go to the various combo. Did you have a single auto stem cell transplant, an auto, which is also called a tandem auto allo? Did you not receive a stem cell transplant? And we'll have the box open for other, but for the life of me, I can't. Hold on a sec. For the life of me, I can't really come up with what an other would be. Then talk about consolidation. What kind of treatment regimen did you have after your stem cell transplants, and how many cycles? And what was your outcome after consolidation? Did you end up with active disease, a partial response, a very good partial response, complete response, stringent complete response, MRD negative, or you're not quite sure? And all of that is in your medical records. And when you sit down with your oncologist, or have sat down with your oncologist, or your treating oncologist, I'm sure that they will have told you exactly, where you come out or coming out after stem cell transplants. We want to understand maintenance. It looks like pretty much all of us have been on maintenance. What combination of drugs, have you been using, or are you using? Are the doublets, triplets, maybe quadruplets? How long have you been in maintenance? Have you relapsed since maintenance? And then how long has it been between the time of your last stem cell transplant and or the time that you started maintenance to the time that you relapsed? And then, what was your outcome after relapse? And we go again through all the combination. You had no response after changing your medication regimen. You ended with partial response, very good partial response, complete response, stringent complete response, etc. So that's just checking off boxes. Go ahead, Audrey, you can page up. And now we also want to understand a little bit more about what kind of strange side effects you've been running into from your treatment. Especially those of us who have been on Revlimid or Pomalyst, we may end up with a case of myelodysplasia syndrome, also called MDS. That's considered a secondary cancer. or the MDS may have progressed already to something called acute myeloid leukemia, which in our case would be a second primary cancer. And again, then we'll go into, have you maybe run into a case of myelofibrosis, or have you had any other evidence of have you had any evidence of other hematological malignancies? But the first, in terms of hematological malignancies that we typically seen with PCL former treatment are either MDS or AML. I'm just trying to get a reading here, you know, what patients have been seeing in their own story. And then obviously, if you've answered yes to this question, you know, can you write in, you know, what malignancy you're dealing with? Have you been treated or have you encountered any other hematological abnormalities? Things like weird anemias, thrombocytopenias, neutropenias, and possibly also polycythemia vera. And if you answered yes to that question, you know, can you please describe what that abnormality would be? And if you've answered yes to any of the questions dealing with secondary or second primary cancers, how did your physician deal with you in the treatment of the second cancers that you've run into? And I think I may have skipped one item there, Audrey. I can't see anything in there dealing with the skin cancers. And I'm not sure if I just read over it or if we ended up, can you page up a little bit, please, Audrey?
Yeah, just a second. I thought we put it in there too. So.
Yeah, I must have read over it. So there is a question in there, you know, have you seen or have you been treated for, no, must have.
Yeah, I must have.
So let's take a note of that. We need to put that back in.
Okay, I must have deleted it.
So we're going to put a thing in there. Have you been treated for any kind of skin cancers? And, you know, we're specifically looking for basal cell carcinomas, squamous cell carcinomas. Excuse me? Melanoma. And possibly melanoma, but that would totally surprise me. And then if you want to page down again, please, Audrey, because we're coming to the very bottom of things. And then we're asking you a couple of broad questions here. One of them is, the first one is, are there any topics that you would like to see included in this questionnaire that you feel we have forgotten? And before we hand it over to specialists for them to clean it up and expand for us. And then the last one is, what kind of topics would you like to see in future sessions of this chapter? Again, there's very few of us, and sometimes it's very hard to find fellow patients who are being treated. It's nice to see that you have patients from a variety of places around the country treated at a number of sterling cancer centers. So, you know, it's good to share. It's good to share treatment programs, and it's good to share thoughts of our own physicians. You know, we can all learn something new, and that's about it from my end for today here. Obviously, we look forward to doing this. I think we're looking to do it every other month, Audrey.
Yes.
And feel free to reach out. Feel free to reach out to Audrey with things you'd like to see covered, you know, things you would like to see discussed amongst the fairly few of us here. And, you know, we'll put it on an agenda. And if you have any questions now, feel free to ask.
Can I ask one thing real quick?
Yeah,
first
sure,
of all, thank you for all your information, Paul. That I appreciate that. Is your wife Vicki O'Neill?
She is Vicki Neal, and she's sitting right across me.
Vicki Neal. Okay. Well, I'm Lori Mitchell. I think she might know my name, but hey, Vicki, and I appreciate all that she does and helps us with also. Did you say 130 people per year are diagnosed with this?
Yeah, 0.4% of all myeloma patients. So you can do the math. There are about 30,000 new myeloma patients per year diagnosed, and 0.4% is 130 or thereabouts.
Wow, I'm
So
shocked.
it is a very,
It
very
is.
rare cancer. And as I said before, and I've my whole professional background has been in pharmaceuticals. There isn't a single sane pharmaceutical company out there that wants to invest in PCL because it's really no money to be made in PCL. Now, myeloma is a different ballgame. So we end up typically being stuck with myeloma regimens and myeloma research that is being tried anecdotally on all of us. And that's one of the reasons, I see Jay, you're nodding your head there. That's one of the things what we're trying to accomplish here. What can we learn from these different treatment regimens? Because all these treatment regimens come from different companies. And nobody pays attention to them. But, here within myeloma crowd, if we have a fairly decent group of people and we can start seeing correlations of, this seems to work better than other things, the medical board of myeloma crowd is literally a who's who in myeloma treatment. We've people in there from every top treating facility in the country here. And, if we can come back to these physicians and say, hey, listen, this is what we learned from our own patients, that some things seem to work better than other things, even if it's only for patients with certain characteristics. It'll be a help for another patient in the future. That is, in my mind, something that I personally would like to see accomplished.
Awesome, thank you. Catherine, we'll take your question really fast, and then we got to finish up. So,
well, one of the things I like to know more about that doctors do not share, and then when I ask questions about it, they still do not share, is nutrition. And before the 1930s, it was all about nutrition, and after the 1930s, it's all pharmaceutical things. And I understand, my husband and all of you have to take these pharmaceutical medications and all. But I like to know what else can we do besides that, like the type of nutrition that I have to research and things like that.
That's a great question. We actually have started a nutrition and wellness chapter in the myeloma community program. Like you guys are doing a session right now. We've done a nutrition and wellness. We just had our first meeting, I can't remember now, Tuesday. And that's one of the things that she said. She's a multiple myeloma specialist. And that's the thing that she is most frustrated about is what is the most common question? What diet should I follow? What nutrition should I follow? What is the least answered question? What diet should they follow? What nutrition should they follow? So she is working, her name is Dr. Urvi Shah. She's with MSK in New York. She is working on making testing what is the most efficient diet and nutrition. And she's actually giving a second talk on February 16th. So in my outro, I'm going to be mentioning some different events that are coming up. And while I don't mention that one specifically, I will, in the slides that I'm going to be sending you also in this follow-up email, along with the survey, this recording, things like that, I send you a link of where you should go to sign up for those future events. And that nutrition and wellness is part of those, because I hear you, Catherine, and I know exactly what you mean, that yes, drugs are helpful, but what else can we be doing for our bodies? I think Mary mentioned she's doing the best she can to have her body be inhospitable to cancer, like what can we do in regards to nutrition and wellness? And we also have a fitness chapter as well, which ranges for all kinds of fitness. We're doing a chair yoga. Anyway, that will be part of my outro that I'm sharing. I'm sharing too much right now, I feel like, but thank you for that question. And we hear you, and we are trying to find a solution to that as well, because we agree that's a question that needs to be answered. With that being said, let me just give you my outro, and then we can let you go for today. Thank you so much for sharing this virtual time with us, for taking a chance on us, and participating in this support group. It's very, very appreciated from all of us. For those of you wondering, when is our next meeting? As Paul mentioned, we're going to try to meet every other month. So our next meeting will occur on March 25th, 2021 at 11 a.m. Mountain, 1 p.m. Eastern. Okay. We hope that you all can participate in that. And if not, remember that these are always recorded. So if you register, they will be sent to you. If you have any questions about what happened today or follow-up questions, you can email me at audrey@healthtree.org. Paul, if you have a question for him, email me and I'll make sure that it gets to him. Upcoming events, so kind of what I was talking about. So on February 2nd at 11 a.m. Mountain, 1 p.m. Eastern, we have our Myeloma Financial Coach chapter, and we're going to be talking about estate planning. It's not a comfortable conversation to have, but it is a needed conversation to have, which is why Myeloma Financial Coach Diana Valentine is putting on that meeting. On Wednesday, February 3rd at 5 p.m. Mountain, 7 p.m. Eastern, we're going to have our Fitness for Myeloma chapter. That is for both patients and caregivers. All of these are for patients and caregivers unless otherwise stated. And we're going to be doing yoga. We're actually going to be doing a sample class of chair yoga from a multiple myeloma patient in Hawaii who has attributed his success of finding complete remission because of yoga. I mean, not because of yoga, but because of fitness, and he loves yoga. So Wednesday, February 10th, we're going to have a Utah myeloma support group. I don't know if any of you, I don't think any of you are from Utah, but we are starting regional chapters as well. So if you are interested in a regional chapter, email me and let me know so we can get one started in your area. And then on Thursday, February 11th at 5 p.m. Mountain, 7 p.m. Eastern, we are going to be having our myeloma caregiver chapter. That is for caregivers only, and we are going to be talking about how to prevent caregiver burnout. www.myelomacrowd.org/events is how you can register for each of those events that you are interested in. All right, let me just finish by saying thanks again to our sponsors, without whom this event would not be possible: Bristol Myers Squibb, Amgen Oncology, and Karyopharm Therapeutics. Thank you each for attending this plasma cell leukemia support group. We are so excited to grow this community with you and find support for one another for such a rare disease. So thank you for participating, and I hope you have a great day, and we will see you next time.
Thank you.
Thanks, Audrey. Take care.
Bye.